That's how they lure you in for the next one.
Okay, everyone, we are live on Facebook.
Hi.
Hi.
I am so sorry. I just need to do one thing for Phil.
Yes.
Sorry.
Can you hold on just 1 second?
Yes.
I'll be
He's
right
the
back.
governor. Go ahead.
Okay. So if you're all watching, we just have to wait just a couple of seconds for the First Lady because she has to do something. We'll be right with you. But thanks for tuning in. But during this time, you hit that watch party, you hit that share button so that everyone can listen.
Mm-hmm.
I'm going to hit the share button too.
Yeah, that's what we'll take this time. Use this time to hit watch. If you hit watch party, more people will be able to see it and you'll be able to help more people get the information.
Absolutely. Absolutely.
Use this time to hit watch. If you hit watch party, more people will be able to see it and you'll be able to help more people get the information.
Absolutely. Absolutely. Okay, so First Lady is back with us.
Hello.
All right, Speight.
Good evening, everyone. I'm excited. Tonight, we are hosting a very special event. Tonight, we have a very special guest, along with a group of dynamic physicians from Clara Maass Medical Center, who are about to talk with us about our health and coronavirus. The overall purpose of tonight's event is to highlight what the healthcare community is experiencing and learning about the impact of the virus. We want to thank and commend all of our heroes who are on the front lines every day, risking their lives for our families and yours. At this time, we want to take a brief moment of silence for all of those who have lost their lives and all of those who are suffering from the coronavirus. Thank you. Thank you. And before we move any further, one of our colleagues, today was such an important day for her. It's her birthday. So we have to wish her a happy, happy birthday. Britt, happy birthday. We love you from the bottom of our heart. Happy birthday.
Thank you so much. Thank you from the bottom of mine.
And don't forget to wash your hands for happy birthday.
Yes. Very good. I'm grateful to see another year. God is good.
God is good.
And my condolences for those who have lost loved ones. Okay, so we're going to actually introduce our guest right now, and we are really excited. I will start first with the amazing, incomparable First Lady, Tammy Murphy, who is doing such a wonderful work around the state. I know that she recently held a fundraiser for COVID-related issues throughout the state. She's an amazing partner to our phenomenal governor, Phil Murphy, who is just really taking this thing head on. And, you know, the interesting thing about COVID is being that we haven't seen this in our lifetimes. This is a new way that we have, a new lens to view our leaders who are rising to the challenge. And Phil Murphy is certainly rising to the challenge and leading this state, keeping as many residents as safe and alive as possible. And I'm so incredibly proud of his leadership, but also that of Tammy Murphy, because beside every great man, we know that there is a great woman, and Tammy Murphy is that great woman and has done a tremendous amount of work also on infant and maternal health, and especially as it relates to Black women and the mortality rates. We also have with us superheroes. It's such an honor because we know that our healthcare workers are on the front lines right now. And we have with us 6 amazing healthcare workers. We have Dr. Naveen Balhem, who is the interim chief medical officer at Clara Maass Medical Center and the director of bariatric surgery. We have Dr. Susan Morrison, AKA JJ, And she is the director of pediatrics, which doesn't surprise me at all because she has a great bubbly personality at Clara Maass Medical Center. Dr. Michael Straker, he's the director of maternal child health at Clara Maass Medical Center. Dr. Frank Califano for respiratory disease, and Dr. Amit Seth, an endocrinologist, which also we know deals with diabetes. And Adrienne Barbier, director of, she's an internist and president of the medical staff at Clara Maass Medical Center. Thank you so much. This is so amazing that you're doing this for us. And with that said, Assemblywoman McKnight, we're going to turn the floor over to First Lady Tammy Murphy, who is going to just address you in her own way, like only she can. Thank you, Tammy Murphy, for being with us.
Hi, everyone. Thank you so much for that introduction, and happy birthday, Assemblywoman Timberlake.
Thank you.
I am so happy to join you, Assemblywoman Speight and Assemblywoman McKnight, as well as this incredible panel of speakers you have lined up. Let me first say that I hope all of you and your families are safe and healthy at home. My heart obviously breaks for anyone who has a loved one who is sick or who has passed in these last few weeks. There is a lot on the agenda this evening, so I want to get right into it. As you are all well aware, we are currently in the middle of a health crisis that has affected almost every aspect of our lives. And while this pandemic is urgent and certainly requires our attention, New Jersey was already in the middle of another crisis, another health crisis, before COVID-19 came to our state. According to America's health rankings, New Jersey currently ranks 47th in the nation for maternal deaths. And for women and babies of color, the statistics are even more dire. A Black woman in New Jersey is nearly 5 times more likely than a white woman to die from maternity-related complications. And a Black baby is 3 times more likely than a white baby to die before his or her first birthday. We started Nurture New Jersey as an awareness campaign to address this problem. Now, 2 years later, we have helped over 5,500 families through our Family Festival outreach events. Thanks in large part, I have to say, to the partnership and advocacy of Assembly members Speight, McKnight, and Timberlake. We are working on a statewide strategic plan to reduce our maternal mortality rate by 50% over 5 years and completely eliminate the racial disparities in outcomes. Unfortunately, because of the COVID-19 outbreak, these shameful disparities are being exacerbated, and our communities of color are at even greater risk. And in order to help mitigate these negative health outcomes, we have had to be more creative in reaching out to New Jersey's pregnant mothers. In the last few weeks, we have held 2 Facebook Live question and answer sessions with Dr. Lisa Gittens-Williams of the American College of Obstetricians and Gynecologists, University Hospital, and Rutgers, New Jersey Medical School. These sessions can be found on my Facebook page at First Lady NJ if you're interested. If you know of someone who is pregnant now, they likely have a lot of questions about hospital procedures, labor, delivery, and bringing their newborn home in the middle of this health crisis. Please let them know that these Ask an OBGYN episodes are available to watch and have a lot of important information as well as questions submitted directly from viewers. They can also submit questions themselves as we plan to hold more of these Ask a Professional interviews in the future. It is our hope that these interviews will answer some of the most pressing questions regarding pregnancy and COVID-19 and help keep our expectant mothers and families healthy during this challenging time. I would also like to share with you a few changes and best practices from the Department of Health's Family Health Services. First, you won't be surprised, pregnant women and their families should take all possible steps to avoid infection, staying home when possible, keeping a minimum of 6 feet from one another if you do need to go out, washing your hands often, and obviously avoiding people who are sick. Second, New Jersey hospitals now allow one support person to be with a woman during labor, delivery, and after birth. This support person can be a spouse, a partner, a doula, a friend, a family member, whatever you choose. Keep in mind that doulas who are unable to attend a birth at the hospital can still provide support via telephone or video communication. Likewise, home visitors can continue to serve pregnant women and families through telephone and video communication. Contact your local home visiting service provider to coordinate care. We've also made changes to WIC to expand the available food choices for bread, eggs, milk, and more. You can continue to access WIC services over the phone and checks by mail. And finally, expected mothers should contact their healthcare provider to discuss any necessary precautions for their birth plan. I know that a lot of information is given to you all at once, so I also want to urge you to visit our Nurture New Jersey homepage at nj.gov/nurturenj. To make all of these resources and information more accessible, we've added a programs tab to the page, which lists any changes to state programs that impact maternal and infant health outcomes. I hope you'll find these resources helpful and share them on social media. In these unprecedented times, you never know who is in need of support, and we want to make sure everyone has access. Before I go, I have to thank Assembly members McKnight, Speight, and Timberlake, who have been incredible assets, advocates, and partners in fighting the maternal and infant health crisis here in New Jersey. Over the past 2 years, the legislature has developed 24 pieces of groundbreaking legislation that have been signed by the governor, including ending Medicaid reimbursement for early elective cesarean sections and providing Medicaid coverage for doula care. Because of their leadership, we are much closer to achieving our goal of becoming the safest place in the nation to deliver a baby. There is no denying that we are going through some real challenges right now, but seeing the way our communities have pulled together and our elected officials have stepped up to support New Jerseyans is really incredibly, incredibly encouraging. Working together is really the only way that we're going to get through the COVID-19 crisis, just as it is the only way we're going to solve the maternal and infant health crisis. So thank you so much for inviting me to be part of tonight's live stream and for all that you are doing for our communities. Stay safe, everyone. Thank you.
Thank you so much,
Thank you.
First Lady,
Thank
for
you.
being here with us. See you soon.
Okay,
Be
thank you
safe.
so much.
Take care.
Bye.
So the First Lady has given us a lot of information. Again, please visit nurturenj.com to get as much information as you possibly can. And we want to thank her for taking time to talk to all of you today. So now we are going to move the program forward, and we're going to talk to all the doctors. So I would like for each of the doctors to introduce yourself, introduce your specialty, and I want you to share an insight about what you have experienced and or learned from the coronavirus and its impact on the population you serve within your respective expertise. And we will start with Dr. Ballin.
Thank you. My name is Dr. Naveen Ballin. I'm the Director of Bariatric Surgery at Clara Maass Medical Center, and I am the Acting Chief Medical Officer at the hospital as well. Obviously, this pandemic has been an incredible surprise to all of our communities and to the hospital. However, I think everybody stepped up to the challenge, and it's affected us all in different ways. With my history as a bariatric surgeon, I think obesity plays an incredible role in catching the virus. There are cells in our body that have locks around them. There are different receptors, and people that are overweight have more of these receptors. They're called ACE2 receptors that make you more prone to catching the virus. And with that, we see that once you capture more of the virus, you shed more of the virus, the outcomes, the complications related to the virus are significantly more, from cardiovascular events to mortality and all sorts of inflammatory processes. The other challenge I've seen with obesity, as we know, obesity affects the body in so many different ways, from diabetes to hypertension to cardiovascular disease to respiratory difficulties. In our COVID patients over the last few weeks, it's always technically a little bit more difficult to intubate obese patients, to give them appropriate oxygenation. I'm sure Dr. Califano will talk later, but we do various things to help oxygenate these patients, such as proning them. Proning obese patients is more difficult. So there's so many physical factors that make oxygenating obese patients very difficult. Lastly, the last challenge with obese patients is their ability to uptake any sort of viral or antiviral medications that we have. The distribution of medications, whether it be the remdesivir that we're hearing a lot about on the news, or any interleukin blockers, is that the availability for those medications to be absorbed and effective in an obese person is significantly less in somebody that's not obese. So there's a myriad of problems with obesity and how it's affected us during this pandemic. So moving forward, I think obesity has been identified as the single most independent risk factor for having a poor outcome. So, obesity has always been a challenge for the state of New Jersey and the US, but I think that we need to really, put more resources behind it around education and access to be able to help our community just become healthier. Thank you.
Thank you so much. So we can just move on. Any doctor want to chime in?
I'm Dr. Califano. I'm director of the ICU. And again, I'd like to thank the First Lady and Assemblywoman Speight, McKnight, and Timberlake for hosting this forum, because it's essential that the community understands that Clara Maass is part of the community. And as the community hospital in the area that serves as a suburb of Newark and Hudson County, it's really the first to take the onslaught of COVID. And as Dr. Bala mentioned, obesity has many faces, and hypertension, hyperlipidemia, diabetes are all related. And in the COVID onslaught, we saw that patients who had these diseases were most at risk for ending up in the ICU. So one of the things that we have to work on as a community-based hospital and as a equip of people working together to serve our patients is to work on these three diseases, making sure that patients have their medications, access to medications, and follow-up, because these are the precursors that will lead to cardiac and kidney disease. Getting a little bit nervous here.
Most people don't know what that word was anyway. So
kidney disease. That's why I didn't want to say, but it will lead to kidney disease. And, and this is what we saw, that patients, if they had a little bit of renal insufficiency, developed a lot of renal insufficiency during the COVID. If they had heart disease, their heart disease was exacerbated. So we really have to make an effort. And this is why I'm so happy about this forum, to make sure people get their medications, have access to physicians, can see an endocrinologist, can see a physician that takes care of their obesity, whether by diet or surgery, have an internist to manage this. And now with COVID, have an immunologist that will tell us when to get tested and contact precaution. This whole equip is present and available for the community at Claremont. So thank you, Assemblywoman.
Thank
I
you.
can go next, but would I be showing my age if I said that I feel like we're on the Hollywood Squares and Mike has the center square? Anybody else remember the Hollywood Squares, or
Yes.
am I that old? I'm that old. Okay.
That was it was
So
a good game.
I'm Andre Barbier. Listen, Mike's got the center square. So I'm Andre Barbier. I am a primary care physician internist in Bloomfield, and I have been in solo practice for 20 years now. My population is basically the south of Bloomfield, and a majority of my patients come from North Ward and Newark and the Forest Hill section. Majority of my practice is Hispanic. A majority is Medicare, Medicaid, and a lot of comorbidities, obesity, diabetes, asthma, hypertension, and hyperlipidemia. So they've got a lot going against them. I think the biggest challenge that I have had with primary care is not so much the patient that has COVID that gets hospitalized, because I have all these great people working together as a team, in addition to the cardiologist, the nephrologist, the respiratory techs, the nurses, and our physical therapy team. The hardest part is the patient that calls the office, has some symptoms and are concerned, they're scared, they're fearful that they may have COVID. I fielded 1,200 calls in the month of April alone. It was 24/7, every hour of the day, people calling, panicking. I had to take a good history, not just a history of the patient, it's a history of who lives in the house with you, who else is sick, what do you do for a living, are you at risk for getting this, do you have fever, how high, all these questions. And I found that most of my patients that did have COVID that I had to treat outside the hospital were people in healthcare, my nurses, my CNAs, my nursing home patients, my EMTs, my police, my firefighters, my taxi cab driver, people who were out in the community still working, they did get sick. Once they were diagnosed positive, we start the treatment at home. We've come up with some treatment protocols. This team that you see in front of you, we meet weekly on the phone calls, we talk, we discuss what's current, what's on the news, what we have to do for our patients, and we follow that in the hospital and out. But still there's fear out there. People are scared. When should they go to the hospital? Do they need to go to the hospital? When can they go back to work? When are they safe to be around their family? These are the things we face every day. And these have been the challenges. And I'm back and forth with the patients that are positive every 2-3 days. They call me when I see the warning signs. Now I have to tell them maybe you need to go to the hospital. That's another issue. They fear the hospital. For them, the hospital is, I'm going to go on a ventilator and I'm going to die. I watch the news. I had 2 very unfortunate incidences where we pleaded, you got to go, you're not getting better, you're not breathing. I had 2 patients that actually died because they were afraid to go. And we're seeing more and more of this. We've had some surgical patients that put off surgery. We've had gangrenous gallbladders that have perforated because people fear going to the hospital. So we need to just really reinforce things that you're safe to go to the hospital. We have safe zones for you if you don't have COVID. And if you have COVID, you need to be there. We've had more successes, more discharge than we've had bad outcomes. And I just don't know how to get that through to the community. I'm constantly on the phone, 2 in the morning, 3 in the morning. They call me at all hours, and it's not getting any better as far as their fear and their trepidation, but the outcomes are getting better. And we need to figure out how we're going to relate that to our patients. Thank you.
Well, thank you. First of all, you just said to not fear, and you're getting the word out right now because you're here tonight. So thank you so much, Doctor.
Thank you.
I'll go next. Thank you, Assemblywomen, for having us. I think this is a great event for the community. My name is Amit Seth. I am a physician who specializes in diabetes, endocrinology, and metabolism. I see patients at Clara Maass Medical Center. My main office is located next to the hospital, and I see patients in the office there. I think we can all agree that the last 2 months have been a challenging time for frontline healthcare workers. I mean, it's been challenging for everybody. I think the teams at Clara Maass, from the nurses, the ER, the ICU, the ancillary staff, management, have done a great job in handling this pandemic. I myself have seen many patients with type 2 diabetes and COVID-19, both in the hospital and virtually in the office. I think patients with diabetes have been hit especially hard. Being a diabetic does not mean you have a higher risk of getting COVID-19, but it does mean you have a higher risk of having more severe complications and more severe symptoms. In general, viruses can cause inflammation on the body. High blood sugars can cause inflammation on the body. The two combined, can make some worrisome outcomes. One of the acute life-threatening complications of diabetes is something called diabetic ketoacidosis. We call it DKA. And this is what happens when your blood becomes very acidic, and it's due to not having enough insulin in the body. Okay? Any stress on the body can cause this. And what I normally see in the hospitals is about 2 to 4 patients per week who come in with diabetic ketoacidosis. Over the last 2 months, there are days where I see 5 to 7 patients in the ER, with diabetic ketoacidosis. And I think, not a lot of these patients have uncontrolled diabetes, but I've also been seeing patients who did not even realize that they had diabetes in the first place. And I think as if there's not enough reasons why it's important to manage your diabetes, to take care of your health, to watch your diet, to exercise. This is just one more reason why it's important to see your physician, to watch your diet, to do all these things so that, you have better outcomes with COVID-19. Thank you.
Thank you.
Yeah, I can go next. This is Dr. Michael Straker. I'm the Director of the Department of OBGYN at Clara Maass Medical Center. I'm a practicing OBGYN in Nutley, New Jersey. My experience so far, and I think any other OBGYN would probably tell you that our population hasn't been hit as hard as we thought it was going to get hit. The pregnant moms we're finding are not at an increased risk for COVID-19, which is a great relief. But there's still so much we don't know about the disease that that research is going to be the key for us. Right now, we've really changed protocols in the hospital in order to keep moms safe, and folks are doing research around the country. But a lot of those research studies are very small studies. They're anecdotal to a large degree. And what we need now is we need more studies that are comprehensive and larger based. Right now, Clara Maass is in the process of entering a study with the rest of the hospitals to follow COVID positive mothers postpartum. What we've seen so far is that the COVID positive moms, because we're testing everybody since April 13th, we've been testing every mother coming in for delivery. And so far, we're seeing about a 10% COVID positive rate, which is, again, a lot lower than what we thought. And at least in our center, those ladies have been mostly either asymptomatic or with very mild disease. So what we're doing now is we're attempting to follow these mothers who are COVID positive postpartum to find out, did they develop any symptoms postpartum? And if they did, how severe were those symptoms? And what kind of services did they need as COVID positive new moms? So far, again, we weren't hit very hard. I'm crossing my fingers that doesn't change, but more information is needed because this is such a new disease. So that so far has been the experience. But and anyone else can talk to the medical piece, but that's what we're seeing obstetrically.
Okay, I'm Susan Morrison, and I'm the Director of Pediatrics. I'm an allergist and immunologist. And to tag on to Dr. Straker, our mothers, we separate them from infected mothers from the babies, and we've actually put them in a separate room from the mothers so they don't infect the infants. The staff knows that the babies are negative, that the mothers are positive, and our staff is so great about teaching about hand washing, wearing a mask. You can breastfeed, but some of them choose to bottle feed. And so this educational component for the community is so important. If people live in a small apartment, how do you keep 6 feet away from them when you've got kids hanging on your legs? So it's important trying to keep the mask on, to do hand washing, even in the house if somebody is infected. Sometimes we've actually sent them home to the godmother for a couple of days to make sure the mother's okay and not going to get sicker, because the mother's positive. How do you know if you're only there for a couple of days that you're not going to get really sick in 5 days? So there's a lot of support system that has to go to these moms. The other aspect that I'm involved in is what we call the expanded access to convalescent plasma. Convalescent plasma is obtained from people who have survived COVID, and they have antibodies. Now, everybody who has COVID doesn't necessarily have to have antibodies. And so they donate their plasma and they test them. So my job is to coordinate who gets the plasma in our hospital, who has the need for it, and work with the doctors, the infectious disease doctors, the pulmonologists, the internists, the whole team, and try to figure out, can we get the plasma and to give it and to follow up. It's a team approach. It was started with myself and Dr. Raja in our pharmacy. Our pharmacy is just super duper at Clara Maass. Mona Phillips is our director, and she's like on the ball getting, when we wanted to get Plaquenil, we got the Plaquenil. We wanted to get a protocol. She and her team got us Remdesivir. Thank you.
Yeah.
We got the IL-6 inhibitor. Huh?
So we're part of the trial. Again,
We're part of so many trials, and you can get anything you want at Alice's restaurant. You can get anything you want at Clara Maass in terms of the top care for any modality that we have. Our surgical staff, terrific. Our hemodialysis, you know, everybody was caught a little late in this epidemic, but we all pulled together, every hospital, every system, New York, New Jersey, it doesn't matter where you are. And we pulled together as a team. Our hospital was unique in that we had every Tuesday morning, 25 to 30 specialists on the phone. What is New York doing? What's Boston doing? What's the literature? What's happening in Italy? What's happening in Spain? Everybody putting their 2 cents. Now we can either get a protocol, coordinated with Mary Ellen Klein, our CEO, sending out memos, what we're going to do, working with the lab, our blood bank, working with the lab for all the protocols that we have to do. It's really amazing how this is really like a team effort, more like a family effort. Even to the point where we have Joe Wozicki, who would use an iPad to communicate with the patient, with the family. Doctors volunteering their time to talk to the families, to give them an update every day. Dr. Agresti, many doctors did this. Dr. Ballum did it. It's just wonderful what has happened. We all pulled together.
To fill in on the medications, we use the Acmera, which is an interleukin-6 antibody that we used to initially in the patients that presented with the COVID. As you mentioned, Mona Phillips, who's the head of pharmacy, we're also doing the Remdesivir trial, and every Friday we call the company and let them know how our progress is. So you're able to get frontline drugs at Clara Maass. Also, we did the convalescent plasma. Initially, when the onslaught came on, we were caught a little bit by surprise. But having a large corporate system like St. Barnabas and Robert Wood, we were able to get up to speed quickly. All right, and that also with the help of the state, getting the extra ventilators in to Clara Maass to help us with the patients. So I have to thank the governor in getting the supply of ventilators to Clara Maass to help the patients. And it was in a timely fashion, and it did help us. I hate to say it, but when the next round comes, we have a plan. And that plan is instituted, we have the resources, and it's going to be implemented, and it's not going to catch us off guard.
The plasma, to get back to the plasma, the Robert Wood Johnson Barnabas Health has a branch in New Brunswick where they're actually having people donate plasma to be used within our system. But there's also the American Red Cross to donate. And there is a website, www.uscovidplasma.org, and you can fill it out. It talks about what the plasma is. It's a blood product, it's a protein, it's an antibody to help fight infection. But not only fight infection, it can be used later on maybe to prevent infection. It's passive immunization. This plasma was slow in coming because people had to recover about 14 to 28 days before they could donate. But we've done about 70 people at Clara Maass. We've enrolled about 150 people. And the earlier we use it, the better it seems to work.
So I think it's important to let people know that one donor can save 4 lives.
Absolutely.
Yeah.
Well, 4 lives with the plasma plus platelets for someone who needs surgery. So 5.
Correct. Okay. Thank you.
You hear all the numbers in New Jersey and New York about all the people that what's happened with the pandemic, how many people are infected, how many people passed away. With my CMO hat at Clara Maass, I want to talk about some of the positive things that we've seen. The RWJBarnabas system has treated and released over 4,000 patients that suffered from COVID. Here at the hospital, we've had over 350 discharges, patients successfully treated with COVID and sent home, whether they were in the ICU or on the floor. We've had 479 patients that were tested and released from the ER. So there have been a lot of great treatment and outcomes. For the patients, and I think everybody on this team kind of put it very succinctly, for the patients that came to Clara, they had, the best options available to them, the latest protocols, the latest clinical trials. So we had a lot of great things happening. From the provider perspective or the healthcare perspective, what I found most moving is how people really kind of lived up to their purpose, right? A lot of us become healthcare workers because we want to go out and we want to help people every day. And by no means do I want to sugarcoat it. I think that's what Dr. Barbier called it yesterday. We were scared. And I think a lot of people coming to the hospital were scared because there's a new disease. We didn't know a lot about what we were getting into, what the outcome was. Were we going to come home and bring this home to our families? Despite that, I think every single nurse, every single person that worked in the pharmacy, in cleaning, in every department through the hospital, really stepped up and did a yeoman's job in taking care of our community. And because of that, I think, that's why we had the great outcomes that we had through this pandemic. The last thing I want to say about that was one of the really nice things. I mean, there were so many nice things that were done. We had so much outpouring from our community. A lot of support. People were buying every unit food. We had so much food delivery and support. We had prayer sessions on our parking deck. The amount of support from our community, I think, really was another thing that helped drive us and our commitment and just gave us the ability to rejuvenate. Every time a COVID patient was extubated or had a positive outcome and was being discharged, we started playing "Here Comes the Sun" in the hospital on the overhead speakers. And that was, just to kind of give all the staff some positivity and an uplifting sense of health and well-being. Those are the little things that helped us accomplish bits and pieces of success each day, and kept us all moving forward. And I think, like Dr. Califano said, this pandemic, I think, took the world by storm. I think everybody in the hospital really stepped up to do a great job. And the next time this thing comes around, if it were to come around, hopefully it doesn't, I think we'll be even more than prepared. Thank you.
Thank you.
I think we
So
have to also
every
give
day
a
we're
shout
learning
out
more and
to
more
our ER people.
Yes. So
Absolutely.
every day we learn
So our ER
I just wanted
people
to say,
are.
learning more and more about this virus. Oh, go ahead. I'm sorry. Go. You could go. Go, Dr. Morrison. Go ahead. So every day we're learning more and more about this virus.
Dr.
And
Brown, you want to talk about the ER?
I want to just say that our ER staff was terrific. They were there. We balanced
COVID areas, so that way patients that were coming in for regular medical issues were able to be seen safely and treated appropriately in a timely fashion. And then we were also given, a lot of opportunity to test patients for COVID. Because we're part of a larger system like RWJBarnabas Health, we had incredible access to and resources to testing. Every day we heard about PPEs and testing on the news. We had an incredible amount of PPEs and testing. Granted, through it, there have been periods of difficulty. There have been times where shortages of things may have happened, but overall, I think that we were able to pivot because we had a great corporate sponsor behind us. And our testing initially took somewhere between 24 to 48 hours. During the peak, we might have gone up to 4 or 5 days, but we quickly pivoted once again, and we were able to get this what's called the Cepheid Test, which is one of the best tests you can have in the country. The results are you get within the same day. and the accuracy is almost 100%. So those are the kinds of things that really enabled us to first diagnose and then treat our patients in a very timely and effective manner.
Thank you. I have a question. So every day, we're hearing more and more about the virus, and it may be a second wave. What are some things that the populations that you serve should be aware of moving forward? Anyone can answer that.
Okay, I think we all share very different perspectives, and I'm sure each of us want to. From obesity perspective, like I said earlier, patients that are obese are higher risk for catching this virus. We saw this back about a decade ago with the swine flu, H1N1. Patients that were obese had higher infection rates and mortality rates. This disease is another pandemic, kind of like the swine flu. And once again, we're seeing patients that are overweight suffer the consequences of it very significantly. So what can we do in case this does come around during flu season at the end of the year? I think it needs to, obesity is a public health concern. Obesity is itself a pandemic. I think people need to take it seriously and focus on healthy eating, exercise plans, and this comes with education, and it starts from our communities. But I think healthy eating and exercise are critical components of our path to wellness.
I think going along with what Dr. Ballum said, with type 2 diabetes and just diabetes in general, it's important to manage the obesity, improve your diet, exercise, and follow up with your primary doctor. I think it's important to be screened for diabetes, especially people who 45 or older, who have risk factors, they're overweight, they have high blood pressure, which is a lot of people. And I think if people are able to catch their diabetes, if people are able to manage it, I think they'll be better equipped to handle future outbreaks, future waves of COVID. So I think all these things are very important.
It's so hard to lose weight. It's so hard to lose weight. We all know what we have to do, but we fail. And so every morning you have to wake up and try harder, or have a team approach, or get your 10,000 steps in. And what's it? What's this? The money? I don't know. But anyway, get your 10,000 steps in, and huh?
Dr. Morrison, in poetry, whenever it's good, people snap their fingers. So that's when you were saying that it's hard to lose weight. It was like poetry to me, because I struggle with it every single day. But I get the point. Exercise.
Or whether you're thin or heavy, to lose a pound is 3,500 calories. It's a lot of work. And we really have to help each other and not sabotage each other. Like, we go to a house and it's your birthday. Do we need a sheet cake? Can we have a little cake? Can we have a piece of cake just for your birthday? Can we just use a 9-inch plate bigger? But these are things that there's a nutritionist in ShopRite. You can go to the hospital. You can go to Dr. Seth to get a nutritionist. We need help to do this, and there are people that are there, and we need to ask. You can do diabetic diets online, and you can measure your food. But I think it's easier when you have a buddy system. If you have a team, it really makes it easier. Just like doing a Zumba class is more fun than jumping around by yourself, right? So, or going to a dance.
Dr. Morrison.
So I think these are the things.
Yeah, what I want to say is obesity is, like you're saying, all of those things. We have access to all of that at Clara Maass. So we have a fully integrated, we have a comprehensive weight loss program at Clara Maass. The COVID-19 has also been a pandemic in the sense that people have been quarantined, the stress around the disease, around what's happening to our jobs, our children being home. All of these stressors are actually making people gain weight. So they're actually making them more sedentary and less healthy. At Clara Maass, we have a comprehensive weight loss programs with dietitians, exercise therapists, and then weight loss surgery. We know statistically that once your weight or body mass index is greater than 30, success with diet alone is extremely rare. So
Right.
once your BMI or body mass index is greater than 30, then surgery becomes a great option. And that's a great way to fight obesity.
I have a question from
Can I just say
Facebook
something
because
real quick? Assemblywoman, is that
You have a
okay?
question from
I just wanted to
Facebook?
say,
Go ahead.
Small steps, okay? Please, small steps, because I know it sounds like a lot, and people that are struggling with their weight, you can do small steps at home, okay? Start with some crunches, take a walk around the block, wear your mask, all right? Just small steps. I just really want to encourage people because it's a major issue in this country, and you know, and with also the mental stress, try not to stress yourself out mentally over it, but you're at home now, you can try to get yourself in a more healthy, nutritious and physical activity type of activity. So just wanted to say that.
So
Thank you.
for me, like as an internist with predominantly older patients, a lot of them will, you can't tell them to exercise if they've got arthritic knees, they've got spinal stenosis, and they'll just look at you and say, it even hurts to walk. So what I've thrown out to them as an option is call your town up in Montclair. There's Wise, there's swimming. There's other things you can do. You can sit and take some 5-pound weights. If you don't have weights, grab your laundry detergent, move your body, get moving. The other thing is you talk to people and you talk about a healthy diet and they'll say, well, those things are just so expensive. The cheap stuff is the stuff that's bad for you, but you know, I'm hungry and it's affordable. My husband teaches in the inner city, and in the schools, they're actually teaching the kids. They have gardens. They're growing their own vegetables. They're bringing stuff home. There is space out there where people can actually maybe grow their own if they can't afford it. We have to teach them this. We have to go over this with them. They have to eat better. And it's so hard when the better stuff is more expensive. So that's a message we have to get across.
Thank you. Thank you. So before I move on to the question that I just received, because there are a lot of people that are watching, Assemblywoman Speight did have a question, and it did any other doctor that did not speak. Do you want to add anything to Speight's question before I move on to the next question?
I'd just like to reiterate that everyone has to follow up with their doctors. I'm the last person you want to see. All right. So you want to see your internist, you want to see your endocrinologist, you want to see your primary care physicians. And by doing that, you will have a pipeline for your medications. So if there is another shutdown that people have to stay at home, you have a relationship with a physician so you can get your antihypertensive medications for the blood pressure. You can get the medications for your diabetes. You can get your aspirin. So it's very important. Go to your primary care physician. Go to your sugar doctor, the endocrinologist. It's very important like that. You have that pipeline, you can get the medications and find out what programs are available to facilitate you getting the medications. You know, the state of New Jersey offers a lot of programs for patients who are in need. And these medications are available. And fortunately, blood pressure medications and diabetes medication are cheap. Metformin, Norvest, all these medications are very cheap, and the state has programs for them. So use this time where we're opening up to get that pipeline with your primary care physician, your subspecialists, who are the endocrinologist, the diabetes doctor, every doctor that you can find. Make that relationship like that. When a lockdown happens, you can call somebody and get your medications delivered at home and be safe.
I just
Frank,
want
I
to say
I agree
pediatricians
with-
are doctors too. Pediatricians,
I'm sorry?
go to your pediatrician and get your baby shots.
Moms
Exactly.
are always good at watching out for kids. They will give up their life for their
Exactly.
babies.
Right.
So that's
right.
No
That's right.
doubt. But from an
Yeah.
obstetric perspective, I agree with Dr. Califano. It's important for ladies who are either pregnant or who are planning to become pregnant to have their medical conditions, well, first of all, diagnose any medical conditions they may have and may not know about, and have those medical conditions optimized prior to a pregnancy, because that will increase their risk for just our routine issues with pregnancy. And then those are also increased risks for COVID as well. So we want to make sure that you're as healthy as possible prior to becoming pregnant, and having a relationship with a primary care physician, you know, reducing your weight, and all those things are super important for women who are becoming or thinking about becoming pregnant.
Okay.
Frank, I think
Dr.
one thing
Shaker,
that's very important
so-
for you as a pulmonologist is we have to get our patients to stop smoking. They have to stop smoking. It's a big problem in my practice where I am, and we've got to get them to stop.
So I tell all my
So Dr.
patients,
Shaker,
unlike
this
food,
question is
you
for
need
is for
cigarettes to live.
you. This question is for
Yes.
you. We received it from Facebook. When you were talking, they want to hear. So the question says, can you please comment on the needs for mental health services and all levels of safe continuum of care to address the emotional health of children, adolescents, families, to support the health and well-being as families and individuals adjust to losses, extreme change, and adapting to the impact of COVID-19 as a major stressor as we adapt to the new norm. So if you can answer that, and then afterwards, if someone else can chime in, please do.
Yeah, I think we can all answer that. I mean, as an obstetrician gynecologist, I see a lot of patients coming in who are stressed out, the anxiety of either being diagnosed or the fear of being diagnosed. How are they going to be able to deliver their baby during this pandemic? Is the baby going to become COVID positive? Those are all issues that definitely evoke fear. We also, again, we all work as a team, and we have access to mental health providers as well. And I've been referring tons of patients to psychologists, psychiatrists, just to be able to have an outlet. So it is very important to be able to have a conversation with someone who does it every day, someone who can kind of address some of those anxieties and kind of walk you through this process. We've never been through this before, so I'm not sure even how equipped the psychologists and psychiatrists are to deal with COVID per se, but they have expertise that can really help them address the isolation that they may be feeling, address the anxiety of being diagnosed or the fear of being diagnosed. So yes, it's quite important. And talking to your physician or reaching out, there are a lot of programs out there that can aid folks in dealing with this pandemic from an emotional standpoint.
I think there is.
Anyone else?
Everyone has a
children,
higher
they're-
level of
they're-
anxiety.
But for children act differently. If you're a toddler, maybe you're not sleeping well, or maybe you're having more temper tantrums. If you're an adolescent, maybe you're not getting out of bed. And these are signs that the parents have to try to get help for their children. And that people are losing 2 and 3 family members. That grief counseling is so important, to talk to somebody about it. And I just think that it's like almost like post-traumatic stress syndrome in some families. And then people being locked up together, not locked up, but they're isolating themselves in a 2-room apartment with 4 or 5 people. It's hard to deal with all that. And so they need to reach out for some psychology, for mental health professionals. We have a grief counseling program at St. Barnabas, and people who've lost babies or people who are just grieving. So that's there. We have psychiatric resources that we just have to, depending what city you live. If you're in Newark, you have to go to Newark. If you're Belleville. But there are, Patterson has their own. So you have to reach out. I called the ER the other morning to find out where I could refer a patient to. And they asked me, what town is it? They'll even go to the house to intervene. So, and for domestic violence, the only hospital in the area that will report domestic violence from the ER, I think, is St. Joseph's. So so if you go to the hospital for that purpose, they can get a court order. So all these issues are bubbling up.
Dr. Seth, do you have something to add?
Yeah, I was saying, I think, with the current conditions, everybody's, has a lot more anxiety. I think it's very important, mental health is a big barrier to, healthier outcomes, with a lot of comorbidities. There's higher risks of depression in people with diabetes. And I think some people are coping with being inside, just eating more and emotional eating. And I think, these are things that patients and people need to be talking to with with their primary care doctors, with anybody, so they can at least get directed to the right people. And these are barriers for there's barriers between family members, and there's a lot of limitations. And I think they need to start with talking to somebody. There's a lot of resources out there, and I think patients may not be aware of them, but they need to reach out to somebody, and we can at least direct them to the right direction.
That's a great point, Dr. Seth. So similarly at the hospital, Dr. Gabe Kaplan, who's the head of our behavioral health for RWJBarnabas, he created for the frontline workers. The frontline workers are supposed to be strong, resilient through thick and thin. However, we know that this is extremely hard and difficult, and we all struggle with what we see and how trying it could be to get patients through this pandemic. So Barnabas has opened up access for doctors to be able to call and be honest about what they're feeling and how they're coping, because it's not easy for any of us on the front lines, or anybody that's stuck at home, like you guys also eloquently explained. But I think the first step is to asking for help, whether it's from your friends, whether it's from your in your church, or whether it's from a behavioral health worker. But I think that we should encourage each other to take that first step.
For children, setting up a routine helps, and we get up, we get showered, we go to work. We need to get up and not live in our sweats. We need to get up and take a shower, take a walk, and get a routine, get some sunlight too. So there are simple things just for someone to do, to write a journal, to keep a log. How many phone calls did I do? Just to see what you did at the end of the day, because it's hard. Time is passing so quickly, and we say, well, what did I do with this? And that gets discouraging, because most of us define ourselves by our family and our jobs. And so we're separated from our family. We're not working. And so it makes it very difficult for all of us.
I think a big problem too has been with the fact that the family members were unable to see the patients. Their family member may be dying on a ventilator and they don't have that contact. They can't touch them. They feel they can't speak to them. So personally for myself, especially with the ICU patients that were vented, I would go in every day, call the family, let them talk to the patient. The wife would say, take his hand, hold his hand for me. I'm going to talk to him. Or, let me see my husband. And there's no fear in them letting see their family member, because you take COVID out of the picture and it's a regular day in the hospital, there's visiting hours. They're going to see them anyway. And a lot of people need closure. They need to see that. And I mean, it could be a month they're in the hospital and the family has no contact with them. So you have to be aware of that. And I'm more proactive here. Here's what they look like. Here, talk to them. And that has helped a lot with my patients. And I think, Frank, you could attest to that with the iPad.
Yes, I think that the hospital made the appropriate decision to protect the populace in general. And while it was so difficult for family members to suffer this distance from their loved ones while they were critically ill, in the greater good was that we were saving the lives of the family members. And that's where I think the patient experience people who help in the family affairs that helped out with the iPads really made a difference, because they were giving that contact, but it was done to protect the family so they would not come down with the COVID and face the onslaught of this devastating disease. So while it was heartbreaking to the staff, because the staff suffered, but they realized that they had to take care of the patients, we were trying to protect the families at the same time. And for the greater good, we made this decision that the ICU would be temporarily off limits to families to protect them. But it was no way made to try to take away some liberties or some rights from the family members. It was really to protect them, and it weighed on everybody for this decision, but we did it for the greater good in mind.
So I have a question as it relates to children again. Unfortunately, the state saw their first death of a person under the age of 18. It was a 4-year-old. Can you share some insight about recent discoveries of multi-system inflammatory syndrome that's showing up in children? And what are some things that the parents should be aware of?
We've seen this syndrome before. We called it Kawasaki's, and you can, but it's pediatric multisystem, meaning multiple organs. Kids who get COVID, a small percentage get COVID, and it's like a cold. You don't even know they have it. But some kids, even after they look perfectly fine, after about week 10 days, they get really sick, and they may get a high fever for 4 or 5 days, conjunctivitis without an eye discharge. They get rashes. Their hands and feet may swell. They may get a rash over their whole body, and they're really sick. They're miserable by the time we see them. But they cannot. They may be having a disease called COVID, but it could be other coronaviruses that have done that, and other things that have done that. But this system, you need to go to a tertiary hospital where you have pediatric subspecialists that can take care of it. Most of the kids have died more recently in New York. I forgot the number, but there've been over 100 kids, and they've actually had a conference through all the intensive care units early May throughout the whole United States, and have come up with recommendations. And the state of New Jersey actually has a form that will talk about that. The doctor, as they see the patient, will talk about fever, conjunctivitis, nausea, vomiting, shortness of breath. We haven't seen many kids with shortness of breath like what the adults have. So if your kid has anything that looks atypical, I'm not talking about the common cold with a fever, but all of a sudden it's not acting right, or maybe their vision's changed, or they got belly pain, that's when you go to the doctors, and the doctor can do some blood work and then send the patient appropriately. You can go to our ER, and we would transfer to Barnabas or Beth Israel, where we have intensive care units. The dangerous part of this is this the pediatric multisystem syndrome is a vasculitis. It means that the same as in the adults, but in kids, it's affecting more their coronary arteries. So when you got that bloodshot eyes, those are vessels that are swollen. And it's the same thing with the vessels in the coronary arteries, the main vessels that feed your heart. They can swell up and stay that way permanently. And so we can treat that. If you catch it early, it's rare, but we can treat this Kawasaki's. We give IV gamma globulin, we give steroids, we give aspirin or Tindra, depending where you are. So most of these kids do survive this disease and without permanent sequelae. But the whole idea is if something isn't right, you know what the common cold is in a snotty nosed kid, but you got that eyes, you got that strawberry tongue, you got those cracked lips, you got a weird rash that you don't know where it came from. That's when you need to call your doctor and have your doctor refer you if you need to be referred. Simple blood tests can help with the screening, and you have a week to 10 days before you get the gamma globulin. It's intravenous, and it works by immunomodulating this vasculitis, and it's treatable. And we usually see 3 or 4 a year at Clara Maass without the COVID-19. And I've taken care of many since 1980. This is not a new disease. It was described by Dr. Kawasaki in Japan in 1967, and we had a big outbreak in Hawaii in 1976. So it's a rare disease. It's not a new disease, and it's associated with coronavirus. It's also associated with norovirus and diarrheal disease. So this is something that you just have to keep in contact with your PCP, keep in contact with it's up to age 18, with your pediatrician. The ones I've seen have been swollen hands in little infants, 2, 4, 6 months of age. Worst prognosis is with little Asian kids. That's because it was described in Japan. But overall, in the United States, and in Japan, we've done very well with gamma globulin.
The hospital is open. As soon as you have a doubt, come to us. Don't think twice. Shortness of breath.
And our
Anything,
ER
come to
doctors
us,
know.
please.
Our ER doctors know all about it because I've talked to them about it. They know about it. And if we have to transfer, we transfer. If we just do the blood test and say, oh, everything looks good. So that's what we need to. Half those kids had positive COVID from nasal swab, 60%. 40% had positive antibody testing, and 14% were negative to everything. So that's the New York group. So, it's temporarily associated with COVID, but it's been around a while.
I think what Frank was getting at is saying Claremont is open for business. We can see the non-COVID patients. We have clean zones. We have clean floors. We have separate parts of the emergency room. Please
Yes.
don't wait. And we don't want any, I had 2 deaths for patients of mine that were afraid to go to the hospital. They could have been avoided. A man and a woman, both in their 50s, they should not be dead. Do not be afraid. Come, we will take care of you.
Bring the children. If anything you need, please come and call your physicians, follow up with them. It's very important. It's very important.
Yeah. What's scary is we've seen a 50% reduction in the number of heart attacks presenting to hospitals. There's no way that 50% of people are suffering less heart attacks. People are unfortunately living with those issues at home, and they're afraid to come in. And I think what this team is suggesting is excellent. The hospital is set up so that you can come there and be safely treated for issues other than COVID. So please don't let these other diseases impact your life.
That's so
fact,
good
I
to know.
thought-
That's so good to hear. And also for new moms, that kind of freak out over every little thing still. We're constantly watching and monitoring. It's good to know cracked lips, strawberry tongue, and
Conjunctivitis without discharge,
conjunctivitis. Yes, thank you. And
fever,
Assemblywoman
and-
Speight.
swollen hands.
Yep.
Swollen
Do
hands
they
and
get
feet.
red palms also? Do they get the red palms?
The little ones do. And then after about 10 or 12 days, you get peeling, but you can peel with other
Oh.
viruses of your fingernails and your skin.
But
It could look like
want to
strep. It could look like a staph.
That's
And
So-
for parents who don't know this, Claremont has a separate emergency room for children. They're taken to a separate side. They're not seen where the adults are seen.
That's so important to know,
Very
because that makes
reassuring,
us feel more comfortable to go to the hospital, to not think you're going to go to the hospital for help, but then get COVID. I know Assemblywoman Speight has a really interesting question that I'm burning to know too.
Okay. So, right now, everyone is running out, going to get vitamin C's, elderberry, zinc, all types of vitamins to boost your immune system. And, is it okay to be taking all these vitamins? Does it not help protect you from COVID? But with your immune system being built up, what does that do with COVID? Because I'm taking everything at this point. So it's almost like, I'm like, is that a protection? I'm like, am I taking too many vitamins at this point? So
What you don't need, you pee out.
Yeah.
It depends on the vitamin, really depends on the vitamin.
the
But I
label.
think, honestly and truly, I think, healthy diet, exercise, and the other doctors will kind of, co-sign that, are probably more important than taking the supplements. A supplement's not going to negate bad habits. So if you're not eating a healthy diet, if you're not exercising, if you're not drinking enough water, not getting enough sleep, your immune system is going to be shot regardless. So you can't negate that with elderberry, vitamin D supplements, vitamin, whatever. So the key is,
Right.
all of it's helpful, but you have to put that on top of healthy eating, healthy lifestyle.
Yeah, I have a lot of patients who take apple cider vinegar. They have cinnamon, and they think that will help their diabetes. But they may work. The vitamin C may help, but it's not a substitute for not taking your medications. People say I want something natural, which there are benefits to different things, but healthy diet, exercise, take your medications. Way more important.
I used to joke with my patients, you'll go looking around for the homeopathic medication, the grass that will make you lose weight, when you get these nice pills that come in bottles that actually work and that doctors prescribe. So take your medications as prescribed by doctors. Believe me, follow up with your internist, follow up with I say sugar doctor because that's how people refer to me. But
You're so sweet.
yeah. Follow with the pediatrician. You have to follow up with your primary care physician. Clara Maass is open. If you have any doubt, please come to the emergency room. We will help you. Prenatal care. You have to take care of this. You can't wait to get scared to come to the hospital. You have to make that relationship early.
Thank you.
one more point about vitamins. There has been an association between vitamin D deficiency and poor outcomes with COVID. And I don't know whether, I think it's too early for us to know whether it's vitamin D that's causing the poor outcome, or is it the fact that most minorities with darker skin have vitamin D deficiency to begin with. And now we're seeing poor outcomes in women in ethnic minorities. So I don't know whether it's from the vitamin D or whether it's because we've seen a higher morbidity and mortality rate amongst, ethnic patients. But I would recommend making sure you check your vitamin D level and making sure that you take vitamin D if you're deficient.
Wow. So much great information tonight. This conversation, listening to all of you, and I know everyone that's watching, they've gotten at least 1 to 2, maybe 3 or 4 things that will help them move forward now with COVID and post-COVID. I want to thank all of you for being on today, on tonight with your expertise and just sharing your knowledge with all of us. And I just want to let everyone know that our staff is on and they're filling in questions, giving me questions to ask everyone up here. And can everyone, if there's a question, can they reach out to Clara Maass to get those questions answered? Everyone is shaking your head. So that is great.
Absolutely.
That is great. So when you're watching, you can definitely reach out to the hospital, any of these beautiful medical doctors that are here to get your questions answered. But I want to just say one thing. It seems like if you have an issue and you need to go to the hospital, please go, because they do have a clean area where they want to take care of you and make sure that you are safe and sound. Dr. Morrison, I see you raising your hand. You have something to say?
Oh, I just want to reiterate, we're a community hospital, our community, right? So we care about our local community and we want to do the best for you. And so please come.
Well, thank you. Assemblywoman Speight, Assemblywoman Timberlake, do you have any closing remarks for everyone that's watching, as well as for the doctors who are on this panel? And I just want to say thank you.
Yes, first, I would definitely like to say thank you to CEO of Clara Maass Hospital, Dr. Mary Allen, for just giving us all these fine doctors. She actually gave us, it was 11 doctors in total. I was like, I don't know if we're able to host 11 doctors, but these 6 that we have tonight, I'm just so grateful that she was able to come through. And also Stacy Newsome, Wendy Martinez, just thank you so much. I just learned a wealth of knowledge on tonight. I know this is needed. I learned so much on tonight, and I know our community learned so much on tonight. So I thank each and every one of you for your time. Just thank you for being on the front lines for our community. Just thank you just so much, just each and every day, because I know I can't even walk in your shoes. I can't even imagine what you're seeing every day. So we just going to continue to pray your strength each and every day that you get up and you go to work. So we just thank you so much. And to our community, we love you. Go to the doctor.
I like this.
So to our community, as you heard them on tonight, what you need to do if you feeling sick, if you having chest pains, go to the doctor. Follow up with your primary care physician. It is necessary. You have to. These are things you have to do moving forward. With COVID, we will get through this. We are here for you. Thank you so much.
Thank you.
Just want to take time to thank Assemblywoman McKnight and Speight for this. It's just such an honor to serve with these ladies. And I say thank you to them every single time, because obviously tomorrow is not promised. And I hope that we have more sense of how real that really is, especially as people unfortunately are losing their lives due to COVID and other things too. Just to piggyback off of what Assemblywoman McKnight said, I had a friend a few weeks ago whose husband passed, and he was afraid to go to the hospital. So I guess maybe is it the shortage of PPE that's been dominating the news, or the respirators, or whatever the fear is, but go, please go.
Yes.
Find a way.
Professionals are there to take care of you. Thank you so much to Clara Maass. And God bless every single one of you who is helping to keep everyone safe and all of those who are watching and who are not. My family is keeping everyone in their prayers. Thank you.
For you people watching out there in the community,
you so
please
much.
continue to pray for our patients and pray for our staff that is taking care of them. We appreciate all your support through the years, and please just pray for us. Thank you.
Thank you. And also I want to thank again our First Lady, Tammy Murphy, for being on with us and during the beginning of the show. Thank you to everyone who's watching. Next week, next Thursday, tune in again at 7:30. We will have another awesome panel that will be with us to talk about a separate topic during coronavirus. So thanks again to everyone that's on this panel. Thank you for all that you're doing. And to everyone, have a good night and God bless.
God bless. Thank you.
Bless you.
Bye.
Good night.